Hello and welcome. Today we're diving into a challenging and often misunderstood condition, cyclic vomiting syndrome or CVS. It's a disorder characterized by episodes of severe nausea and vomiting that can last for hours or even days, followed by symptom-free periods. It can be incredibly disruptive to daily life, and we're going to explore what it is, what causes it, and how it's managed. Pinpointing the exact cause of cyclic vomiting syndrome is complex, and it's often considered multifactorial. Genetics seem to play a role in some cases. Migraines are also highly linked, with many sufferers or their family members having a history of migraine headaches. Other potential triggers include infections, stress, anxiety, certain foods, lack of sleep, motion sickness, and even changes in weather. It's important to note that often, no single trigger can be identified. The pathophysiology of CVS isn't fully understood, but there are several leading theories. One suggests a dysfunction in the brain-gut axis, the complex communication system between the brain and the digestive system. Another involves mitochondrial dysfunction, affecting the energy production within cells, which can disrupt normal bodily functions. Imbalances in neurotransmitters like serotonin and dopamine may also contribute, influencing the nausea and vomiting centers in the brain. These theories are still being researched and further exploration is ongoing. Cyclic vomiting syndrome can affect people of all ages, but it's most commonly diagnosed in childhood, typically between the ages of 3 and 7. However, adults can also develop CVS. The prevalence is difficult to determine precisely, as it's often misdiagnosed or undiagnosed. Studies estimate that it affects somewhere between 1 and 2% of children, and the numbers are growing. There appears to be no significant difference in prevalence between genders. The hallmark of cyclic vomiting syndrome is, of course, recurrent episodes of intense nausea and vomiting. These episodes are stereotyped, meaning they tend to be similar in each individual. The vomiting can be so severe that it leads to dehydration, electrolyte imbalances, and even esophageal tears. Accompanying symptoms often include abdominal pain, headaches, dizziness, lethargy, and a sensitivity to light and sound. During symptom-free intervals, individuals generally feel completely normal. Diagnosing CVS can be challenging as there isn't a single definitive test. The diagnosis is usually based on a thorough medical history, physical examination, and exclusion of other conditions that could be causing the symptoms. Doctors may use the ROM-IV criteria, a standardized set of guidelines for diagnosing functional gastrointestinal disorders, including CVS. Tests may be performed to rule out other conditions, such as gastrointestinal blockages, metabolic disorders, or neurological problems. Keeping a detailed symptom diary can be incredibly helpful in establishing a pattern and supporting the diagnosis. While there aren't strictly defined types of CVS, it's often categorized based on the age of onset. There's childhood onset CVS and adult onset CVS. Additionally, some researchers categorize CVS on associated conditions, such as migraine-associated CVS. However, these are more for descriptive purposes than distinct classifications. Treatment for cyclic vomiting syndrome focuses on managing symptoms during episodes and preventing future episodes. During an episode, treatment primarily involves supportive care, such as intravenous fluids to rehydrate, antiemetics to reduce nausea and vomiting, and pain medication. For prevention, lifestyle modifications, such as managing stress, ensuring adequate sleep, and avoiding known triggers, can be helpful. Medications like amitriptyline, cyproheptadine, and propranolol are sometimes prescribed to reduce the frequency and severity of episodes. Coenzyme Q10 and L-carnitine supplements are also often used, particularly when mitochondrial dysfunction is suspected. Prevention of cyclic vomiting syndrome relies heavily on identifying and avoiding triggers, maintaining a healthy lifestyle, managing stress through techniques like meditation or yoga, ensuring adequate sleep, and avoiding known food sensitivities can all play a role. If episodes are triggered by specific events, like travel, preemptive medication may be considered. The prognosis for individuals with cyclic vomiting syndrome varies. Many children outgrow the condition as they get older, although some may develop migraine headaches later in life. Adults often continue to experience episodes for a longer period. Recent research is focusing on understanding the genetic and neurological underpinnings of CVS. Studies are exploring the role of the endocannabinoid system and developing new pharmacological targets to treat the condition. There is ongoing research using neuroimaging to examine possible mechanisms in the brain that may be contributing to CVS. Further investigation of the mitochondrial dysfunction in the brain-gut axis will hopefully provide more targeted and effective therapies in the future.